Hello. Today I'm going to be talking about murmurs, heart murmurs. Now, the way that I like to think about heart murmurs is I like to think about what murmur is going to occur during different parts of the cardiac cycle. So, we have two phases of the cardiac cycle. We have systole and diastole. And we have two types of murmurs, either a regurgitant murmur or a murmur from a stenotic valve. Now, during systole, we're going to be pumping blood out of the heart, and during diastole, we're going to be pumping blood into the heart. And so thinking about the two types of murmurs that we're going to find in the heart, we're going to find either a regurgitant murmur or a stenotic murmur. The stenotic murmur is going to be described as a high-pitched murmur. That's going to be from blood flowing across a calcified valve. And a stenotic murmur you're going to hear during from the valve that is normally open during whichever phase of the cardiac cycle you're hearing it in. So for instance, during systole, the aortic valve is normally open. So during systole, if you hear a murmur from the aortic valve, that's going to be a stenotic murmur. And similarly, during diastole, if you hear a murmur from the mitral valve, it's also going to be a stenotic murmur. In contrast, during systole, if you hear a murmur from the mitral valve, it's going to be a regurgitant murmur. And similarly, during diastole, if you hear a murmur from the valve that should be closed during diastole, the aortic valve, that's going to be a regurgitant murmur. The murmur from regurgitation is described as a blowing murmur, and that murmur is due to valves that don't fully oppose and are described as floppy valves that allow blood to flow back across them during either systole or diastole. Now, let's begin by going over the different cardiac cycles and what murmurs you will hear during each cardiac during each phase of the cardiac cycle. So during systole, if you hear a high-pitched murmur, that is going to be a murmur from the aortic valve. You're going to hear this murmur in the right second intercostal space. It's going to be described as high-pitched, and that is going to radiate up and into the carotids. The aortic stenosis, on physical exam, you're going to find a pulse that is both late and weak. What that means is that when you hear the murmur and you're feeling the pulse, the pulse will feel late in contrast to what you're hearing in your stethoscope, and that pulse is also going to be weak. That is because the heart is having a hard time pumping blood through the stenotic aortic valve. The symptoms from aortic stenosis are going to be syncope, angina. You can go into chronic heart failure, and you're going to see this. You're going to see stenotic aortic valves in elderly patients, and you can also see it in kids that were born with a bicuspid or unicuspid valve. This can be a very devastating disease. So you're going to want to follow these patients closely with echocardiogram, because the mortality rate is really high as it becomes more severe, and these patients are going to need a valve replacement eventually. So going back to the systolic phase of the cardiac cycle, the other murmur that we can hear is blood flowing across the mitral valve. Now, this murmur is going to be a regurgitant murmur. So it's going to be described as a blowing murmur a holosystolic blowing murmur, a murmur that occurs during the entire systolic phase of the cardiac cycle. And that's going to be best heard at the apex of the heart on physical exam. The symptoms of a mitral valve regurgitation are going to be symptoms from the blood backing up into the lungs, or the pressure increasing in the lungs from the blood going back into the pulmonary system. So you're going to have shortness of breath when you lie down at night, and on the chest x-ray you're going to see pulmonary edema, and when you auscultate the lungs you're going to hear crackles from the pulmonary edema. Now, mitral valve regurgitation is most commonly due to rheumatic heart disease. You can also see mitral valve regurgitation with chordae tendineae rupture after a myocardial infarction. Typically, you'll see that from 3 to 10 days following a myocardial infarction. And you can also see it with Marfan syndrome. The treatment for mitral valve regurgitation is most likely going to be a valve replacement or a fix of the mitral valve. Now, moving on to diastole, the two murmurs that can occur during diastole, again, are going to be either from the blood coming back through the aortic valve by regurgitation, or blood coming from the left atrium into the ventricle through the mitral valve. So the aortic valve is going to be a regurgitant murmur. You're going to hear that murmur at the left sternal border, and again, the regurgitant murmur is going to be described as a blowing murmur. Now, in physical exam, you're going to see a very wide pulse pressure. And what that is due to is as blood is rushing back into the left ventricle, that's going to increase the amount of blood at the end of diastole in the left ventricle. And if you remember your Frank-Starling law, as the end diastolic volume increases, contractility conversely increases as well. And so the heart is going to hypertrophy and become stronger to push that extra blood up and out of the heart and into the aorta. But that aortic valve is going to stay open, and after the blood rushes into the aorta, it's going to rush back down in. So the pressure coming out is going to be really high, but just after systole ends, the blood is going to rush back into the heart, and therefore the diastolic pressures are going to be very low in the body. So that's going to give you a very wide pulse pressure. And when you, on physical exam, as you palpate the pulse, you're going to feel what they call a water hammer pulse, which is a very strong pulse on the. So the symptoms of a aortic valve regurgitation are going to be orthopnea, again, which is shortness of breath with lying down, pulmonary edema. Both of these symptoms are going to be due to blood going back into the left side of the heart and increasing pressures in the pulmonary circulation, because the atria is going to have to be pushing against much higher pressure since there's going to be blood already in the left ventricle that it's going to be fighting against. So the pressures are going to increase in the pulmonary system, and you're going to see edema and shortness of breath with lying down. Now with this aortic valve regurgitation, you can also see cardiogenic shock, as the heart is going to, you're not going to have enough blood flow to your body to to perfuse your organs. So the causes of mitral valve regurgitation are varied. For acute aortic valve regurgitation, that's commonly due to endocarditis or aortic dissection. But chronic aortic valve regurgitation is most likely due to rheumatic heart disease, although Marfan's can commonly cause aortic valve regurgitation as well. Now, the treatment for this condition is going to be either a repair or a replacement as well. Now, the other murmur that we're going to hear during diastole is going to be from the mitral valve. Now, blood rushing into the left ventricle from the left atrium during diastole. If there is a murmur, again, it's going to be from a stenotic valve. With the mitral valve stenosis, what you're going to hear is a mid-diastolic opening snap and then a mid-diastolic blowing murmur. The mid-diastolic opening snap is due to the left atrium contracting halfway through diastole to push blood into the left ventricle. So you're going to hear that mid-diastolic opening snap and then the blowing murmur following that. This murmur is best heard at the apex of the heart. The signs and symptoms of mitral valve stenosis are going to be, again, pulmonary edema and shortness of breath with lying down. The atria is going to be pushing blood through this smaller stenotic mitral valve, and that's going to increase pressures in the pulmonary system. And the cause of mitral valve stenosis is, again, rheumatic heart disease, most commonly. For mitral valve stenosis, what we can do is, as far as treatment, is we can actually put a balloon into the heart and into the mitral valve and expand that balloon to open up the mitral valve. Patients also commonly will just need a replacement of that valve as well. So in summary, going over our murmurs, there's going to be two types of murmurs: regurgitation and stenotic murmurs. And these two murmurs are going to occur in either the systolic or diastolic phase of the cardiac cycle. During systole, blood naturally goes through the aortic valve and into the aorta and into the body, and that's going to create a stenotic murmur. It shouldn't go through the mitral valve, but if it does, then you're going to have a regurgitant murmur. In diastole, blood normally flows from the left atria into the ventricle through the mitral valve. So if you have a murmur from the mitral valve, that's going to be a stenotic murmur. It shouldn't flow back from the aorta into the left ventricle, but if it does, you're going to have a regurgitant murmur. Thank you.